Hi, I'm Michelle. I'll be scheduling your procedure.
And I'm Kelly. I'm the nurse at the Norman Parathyroid Center, and we're here to help explain the process of scheduling surgery.
Once you've had your consultation with the physician and I've scheduled your procedure, you can expect to receive 2 telephone calls from Tampa General Hospital. One call will be the pre-op nurse, the other call will be pre-registration. The pre-op nurse will tell you what time to check in the morning, and keep in mind it could potentially be as early as 5:30 or 6 o'clock in the morning. She'll also tell you exactly where you need to go to check in. You'll be checking in at Tampa General Hospital. You don't need to check in at the Norman Parathyroid Center.
Yep. She'll give you directions once you get there, what elevator to take, what floor to get off. They'll give you all of those little simple directions. She'll also be telling you nothing to eat or drink after midnight, and going over a list of medications with you, and she's going to want to know if you're taking any daily aspirin or blood thinners. If you are, we're going to ask you to stop taking them 5 days prior to the operation. Now you can take Tylenol, Advil, Excedrin, ibuprofen, all of those sorts of things, any supplements that you want. They're all fine to take. The only thing you can't take would be straight aspirin or baby aspirin. And if you're taking Plavix or Coumadin, we would like you to stop taking that 5 days prior to the operation with your doctor's permission. Also, if you're taking any blood pressure or heart medication, you are allowed to take that with just a small sip of water before heading over to the hospital. That's the only thing you're allowed that morning. All other medications you can take after the procedure.
Now, if you're traveling to Tampa from outside of Florida, or if you have a lengthy drive within Florida, you'll want to be in Tampa by the afternoon or the evening the day before. You don't need to check in with us, but that will allow you to be at the hospital the following morning. For information regarding hotels, please refer to our website at www.parathyroid.com. Make sure you tell them that you are having the procedure with Dr. Norman at Tampa General Hospital so you can get a discount.
Okay, what you can expect once you get to the hospital is the first person you're going to meet is going to be Dr. Politz, and he's going to sit with you and he's going to go over post-op instructions with you. He's going to give you a bottle of calcium pills and all the instructions for taking them after the operation. Once you've had your conversation with him, you'll be brought back to the holding area by the pre-op nurse, and she's going to change you into your hospital gown, start an IV for you. You'll probably meet with anesthesia and get you ready for your procedure. And once you're all settled, they'll take you over to the nuclear medicine department, and you're going to have your system EV scan done. And they're actually going to give you your films to bring with you back to the holding area. And you'll meet Dr. Norman. He's going to come in and he's going to review your films with you, and he'll look at them and say, you know, look at that, this is the guy I'm going to take out, and it'll just take a few minutes, and he'll answer any last minute questions that you have with him. Then you go to the surgery area, have your procedure, which should just be a few minutes. Then you're brought to the recovery room where you stay there for about an hour and a half. I should also mention that if you have someone come with you to the hospital, which we recommend that you do, that they can be with you every step of the process, except obviously when you're in the sterile surgery area, but they can be with you everywhere else, and then you just go home about an hour and a half after being in the recovery room.
You can go home the same day as long as you have a companion doing the driving for you, or if you're flying home, you can fly home the day after.
So we hope that this has been helpful to you to plan your surgery here at the Norman Parathyroid Center, and answered a lot of questions for you, and please feel free to refer back to it anytime.